Welcome to this brief video on the Chinese herbal formula, drive out stasis in the mansion of blood decoction, or 血府煮油汤 in Chinese. This is a powerful and popular formula used for treating pain caused by both blood stagnation and qi stagnation. The formula first appears in Wang Qingren's 19th century book, The Correction of Errors in Medical Works. Wang Qingren was one of the first TCM doctors to seriously question classical anatomical assumptions in Chinese medicine. While he was practicing medicine in Hebei, there was an epidemic which killed many people. As there were many corpses, they could not bury them in time, and dogs began to chew on the bodies, exposing their viscera. This gave him the opportunity to examine the anatomy of the cadavers more closely. He wrote his book on the basis of these observations. However, some of his observations were incorrect, and his conservative colleagues responded with the saying, "Yilin corrects mistakes. The more it corrects, the more it makes." Nevertheless, he developed a series of formulas that were known to be effective, and again he was chided with the saying, "The formulas work, but the theory is mistaken." 血府煮油汤 translates as drive out stasis in the mansion of blood decoction. Fu is a mansion. The blood mansion he refers to is the chest cavity. Wang Qingren made his gruesome observations after dogs had consumed the heart and liver of the cadavers, and often blood pooled in the chest cavity. He related disease to this phenomenon and named this area the blood palace or mansion. This was the origin for the name of the formula. This is one of a series of formulas that Wang Qingren proposed, which all have the suffix 煮油 or to expel stasis. As the name implies, 血府煮油汤 is classified as a formula that invigorates blood and dispels blood stasis. The formula consists of 11 herbs altogether and looks fairly daunting at first glance. However, we can look at it as being made up of two well-known smaller formulas, Tao Hong Seu Tang and Senisan, with small variations and additions. To understand it better, it can be helpful to compare this formula to Tao Hong Seu Tang and a different qi-focused formula, Xiao Chaihu Tang. You can find references to my videos on these formulas in the description section below. Tao Hong Seu Tang is a relatively simple formula, whose actions are focused on invigorating blood. Xiao Chaihu Tang is a more sophisticated formula, whose actions are focused on harmonizing qi. 血府煮油汤 is a more complex formula that incorporates the blood-invigorating herbs of Tao Hong Seu Tang and at the same time acts on qi circulation in a balancing manner. The component formula Senisan is a very simple formula that harmonizes and rectifies liver qi to regulate the spleen, which is important for qi production. The liver is the organ most susceptible to qi imbalance. In this way, 血府煮油汤 is able to effectively disperse stasis and alleviate pain. This formula can be seen as an amalgam of two formulas, Tao Hong Seu Tang and Senisan, with 3 modifications and with the addition of 2 herbs. In Tao Hong Seu Tang, Shu Di Huang is replaced by Sheng Di Huang, Bai Shao is replaced by Zhi Shao, and Zhi Shi is replaced by Zhi Qiao. If we look at the dosage, the blood-moving herb combination Tao Ren and Hong Hua are prescribed in highest dosage and are regarded as the Jun or sovereign herbs. I have already discussed Dangui, Chuanxiong, Tao Ren and Hong Hua in my video on Tao Hong Seu Tang. So now let's look at the herb substitutions I mentioned. 血府煮油汤 replaces Shu Di Huang with Sheng Di Huang. Shu Di Huang is the cooked form of the herb. It is slightly warm, very cloying, and nourishes the blood. By contrast, Sheng Di Huang is the unprepared form. It is cold in nature and cools the blood. Chronic blood stasis will generate heat, resulting in palpitations, insomnia, and restless sleep. Sheng Di Huang will help to clear this heat. If the practitioner wants to temper the coldness, he can prescribe both Sheng Di and Shu Di in the formula together. Sheng Di Huang nourishes the blood by enriching yin, and promoting the secretion of fluids. Tang replaces Xiao with Xiao. In the earliest texts, there was no differentiation between Xiao and Xiao, and they were referred to as Xiao. However, the difference in their properties has always been recognized. Xiao is blood invigorating, while Xiao is blood nourishing. Both have an important effect on the liver. Xiao is better at transforming stasis, and its cooling nature is especially effective with toxic hot blood. It is thus suitable for painful obstruction and amenorrhea in these circumstances. Tang replaces Zhi with Zhiqiao. Various parts of the orange and tangerine play an important role as qi herbs in traditional Chinese medicine, and this slide shows some of their usage. Zhi and Zhiqiao are the same fruit, that is, bitter orange, but at different stages of maturity. It is this difference in maturity that accounts for the differing assessment of the qi properties of these two versions of the herb. Zhiqiao is also referred to as Zhike. The basic properties of both herbs are identified as being the same. They are both bitter, acrid, sour, and slightly cold. Both break up qi and disperse phlegm and masses, reducing distension. Although they're said to act on the same organs, Zhiqiao, which is mature, acts more gently and mainly on the upper part of the body, that is the chest and diaphragm, while the immature Zhi is said to have more active qi and acts more on the spleen and stomach. Because of their strong qi action, neither herb should be used in pregnancy. Next, we'll look at the 4 remaining herbs in the formula. Chaihu is bitter, acrid, and cool. It is associated with the gallbladder, liver, pericardium, and sanjiao or triple burner channels. Chaihu harmonizes the exterior and the interior. It upbears yang and raises the clear qi of the stomach and gallbladder. It courses, spreads, and soothes the liver to resolve depression and relieves liver qi constraint. In using Chaihu, you should be aware that appropriate dosage is important for effective treatment. In this formula, a low dosage of 3 grams is recommended, which, as we will see, is in line with the qi activity that we're seeking here. As this herb is associated with raising and dispersing, it should be used with care in cases of liver yang hyperactivity and severe yin injury. Jiegang is the root of the Chinese balloon or bellflower. The bud of this beautiful flower swells like a balloon before opening. It is commonly eaten as a vegetable or dessert in Korea. It is bitter, acrid, and neutral in nature, and is associated with the lung channel, which corresponds to the acrid taste in the 5 transformations diagram. Jiegang opens up and diffuses the lungs, dispels phlegm, and treats the throat, making it very useful for colds or flu. Because it raises qi, it is also very commonly used as a messenger herb in Chinese formulas to guide the action of the herbs upwards. Because of its qi-raising nature, it should not be used when there is yin deficiency or if the patient is coughing up blood. Chuanyouxi is Safflower root grown in the Sichuan region of China. It is called ox's knee in Chinese because of its characteristic shape. It's worth noting that Nyoshi is also used in Ayurveda for hemorrhoids under the name Apamarga. Chuanyouxi is bitter, sweet, and neutral, and associated with the liver and kidney channels. As a blood-invigorating herb, it dispels stasis and unblocks the channels, but it is also important as it moves qi downwards. This helps in treating urinary problems and explains its use as a qi-directing herb in formulas. Because of this qi property, it should not be used if there is excessive menstruation or if the patient is pregnant. In fact, this herb was well known for its use in abortions. Zhigancao is used for tonifying the spleen to boost qi and for harmonizing the characteristics of the herbs in the formula. Tang has 7 herbs which act on the blood. The majority of the blood herbs are blood invigorating. 5 of the formula's herbs act on qi. Most of the herbs in this formula have an acrid taste. This property is closely associated with qi movement. For balance, there is an equal number of heating and cooling herbs in the formula. Tang has 3 sets of paired herb combinations. The Jun herbs, Taoren and Honghua, alleviate pain by powerfully invigorating blood. Dangui and Chuanxiong nourish and move blood, dispelling stasis and stopping pain. Jiegang and Xiao are important qi herbs. Both disperse phlegm, which in Chinese medicine has a slightly different notion than in the West. In TCM, phlegm is a pathological accumulation of fluids arising from qi deficiency or qi stagnation. Jiegang acts on the upper burner and directs qi upwards, while Xiao acts on the middle burner and directs qi downwards. Together, these herbs treat distension in the chest and balance the movement of qi. If we look at the qi herbs, we can see another important aspect of the elegance of this formula. As in Chaihu Tang, qi movement needs to be managed carefully. In the formula, Jiegang and Chaihu move qi upwards, while Xiao and Chuanyouxi move qi downwards. The practitioner can adapt the dosage of these herbs to suit the particular condition of the patient. The actions of the formula are to invigorate blood, disperse stasis, move qi, and alleviate pain. It treats blood stasis in the chest. This formula mainly treats the blood, but it also treats qi. This is important because of the intimate relationship between them. In traditional Chinese medicine, or TCM, it is said that qi is the commander of blood, and blood is the mother of qi. When qi moves, blood flows. When qi stagnates, blood coagulates. To treat blood effectively, we need to treat qi as well, particularly if pain is involved. According to TCM, pain is a result of stagnation. A key notion is that when qi or blood flow, there is no pain, and when they do not flow, there is pain. It's important to note the difference between pain caused by qi stagnation and pain caused by blood stagnation. Pain due to qi stagnation is more like a discomfort, which can vary in intensity. By nature, this pain is distending, diffuse, and not easily localized. On the other hand, pain due to blood stagnation can be described as sharp, deep, or stabbing, and has a fixed location. The signs and symptoms associated with Xuefuzhuyu Tang are a chronic stabbing pain in the chest or diaphragm. This can be accompanied by a stubborn headache with a fixed, piercing quality. These kinds of pain can readily be associated with blood stasis. There may also be a sensation of chest distension, which could be related to qi stagnation. Stasis will begin to affect the heart, giving rise to palpitations, depression, and low spirits. Also dizziness, insomnia, and restless sleep. Women may be experiencing dysmenorrhea or amenorrhea. The patient would have dark purplish lips. The tongue would be dark red with red spots or petechia. The pulse would be choppy or wiry and tight. The TCM signs and symptoms just mentioned can be found in coronary artery disease and angina. A meta-analysis of trials published in PubMed indicates that combining Xuefuzhuyu Tang with Western medicine for treating angina results in a better outcome. I give the reference in the description section below. The formula has also been effective for rheumatic heart disease, hypertension, and in treating certain types of headaches. It is also used for dysmenorrhea and amenorrhea. Because of the large number of blood-invigorating herbs used, the formula should be avoided in pregnancy or if there is excessive menstrual bleeding. Thank you for watching this video, and I hope you'll join me for future videos in this series.